It's been nearly 24 years since Dr. Pankaj Srivastava first came to Dubai from London, United Kingdom. In 1991, he started the UAE's first infertility unit under the Dubai government's patronage, and that went on to become an incredibly successful program. Then, in 2004, he established his own infertility hospital, the CONCEIVE Gynecology and Fertility Hospital. Having devoted his medical career to reproductive medicine, Dr. Pankaj Srivastava has been at the forefront of building families not just in the UAE, but across the globe. Today, he has been instrumental in the birth process of close to 5,000 babies. World-renowned, widely respected, and very loved for the warmth and the sincerity with which he approaches his work, Dr. Pankaj Srivastava is a household name in the United Arab Emirates. On a personal note, I have had the fortune of knowing the man behind the physician, and as such, it gives me great pleasure to have this little chat with him today and talk all things about infertility. It's my attempt to educate the public and spread awareness about this growing concern. So without much further ado, hi Dad!
How are you, Damini?
Thank you for letting me do this and putting you on the spot. So, does it feel like it's been that long?
You know, it feels like it was only yesterday when we were setting up the first fertility center in the UAE. At that time, it was not as acceptable as it is now.
Right.
Fertility treatment, especially IVF, was looked upon with a great deal of suspicion. People weren't quite clear whether it was acceptable by the religious authorities.
Right.
People weren't clear whether babies that were going to be born from this treatment would be normal. But all that is now behind us. We know that there is no problems as regards religion in fertility treatment. IVF is completely sanctioned and it's within the permissible treatments as far as all the major religions are concerned. And we now know that babies born after fertility treatment, especially IVF and ICSI, don't show any increased rates of abnormalities.
Absolutely. So would you say that the stigma that is attached with infertility, and you know, it's quite a taboo topic, probably in this part of the world more so in the West, have you seen that decrease or decline?
Well, it's definitely declined, but I wouldn't say it's gone away completely.
Okay.
When we first started IVF in Rashid Hospital in Dubai, we would have phone calls from potential patients asking if there was an entrance from the back so that they wouldn't be seen.
They didn't want to be
They
seen.
didn't want to be seen walking into a fertility center. And in those days, quite often, men would not accompany their wives. They would just send the wives.
Because it was a woman's problem.
It was a woman's problem.
Right.
But now I think men are more aware that it can be a problem, either a combined problem between both the husband and the wife, or a problem completely just limited to the man himself.
Okay.
So we very rarely now see unaccompanied women coming for fertility treatment. I think that's a major progress. Men are now accepting that it can be
They're
a
being
problem.
put on the spots as well, and that they're not perfect.
Yeah.
Why is infertility such an issue today? Because in my own friend circle, you know, people not very much older, because traditionally we always thought as you grow older, your chances of conceiving are less. But today I see young couples struggling. Why is it becoming such a growing concern?
Infertility exists in roughly 15% of couples all over the world. Unfortunately, we don't have figures for this part of the world. But my suspicion is that it may be more than what is normally reported all over the world. And I suspect that probably about 20% of couples in this part of the world either aren't able to have a child, or they're not able to have the desired number of children. They could have one, but when they try for the next one, they're not able to do so easily. So the incidence in this part of the world, I suspect, is higher than in other populations.
And what would you attribute that to? I mean, why are we being targeted?
Probably because of bad genes,
Oh gosh.
bad lifestyles. Well, as far as the women are concerned, for instance, we know that the Middle East and South Asia are two regions where there's a very, very high incidence of diabetes. In fact,
Yeah.
some of the highest incidence of diabetes in the world are in these two regions.
Right.
And associated with diabetes is a condition that afflicts women called polycystic ovarian disease. We see a lot of polycystic ovarian disease in the UAE,
Okay.
and it afflicts not only the local Emirati and Gulf women, but
Right.
also the women from the South Asian subcontinent.
Right. Okay. And this is a genetic.
Well, there is a genetic
Traits,
link to that,
yeah.
but overlaid onto the genetic element is the lifestyle issues.
So what do you mean lifestyle? I mean,
Well,
what are we doing wrong?
Well, for one, in the old days, even with the same genes,
Yeah.
because girls were slimmer, they were more active, they were doing a lot more work, they weren't overweight.
Okay.
But now, with the present lifestyle where there's minimal activity in day-to-day existence, food is much, much richer.
Yeah. I'll
Fast
say.
foods are available aplenty. Pepsi, chocolates, ice cream are the norm. Girls are putting on much more weight. And this tips the balance in favor of the full-blown polycystic ovarian syndrome.
Okay.
And that's why we're seeing PCOS being more manifest in the population in this part of the world.
And weight gain is a huge problem in the UAE because,
Absolutely.
I mean, there are figures that are coming out now which are alarming when it comes to obesity, whether it's in children, whether it's in young adults,
The entire spectrum of the population
is overweight.
is overweight, or there's a large proportion of people who are overweight, and this is going to have a very bad effect on fertility.
So that's essentially the weight and the diet. Is there anything else that people here are doing wrong in terms of, well, I mean, I hate to say this because I know this, but smoking and drinking is never recommended by any physician.
Well, smoking, we know, is definitely highly detrimental to both male and female fertility.
Okay.
We know that girls who smoke run out of eggs and reach menopause roughly about 4 to 5 years before girls who don't smoke. And this is not just active smoking, even passive smoking. If
So if
the
their
partner
partner is smoking
is
or-
smoking, they are more likely to run out of eggs 2 or 3 years before they would normally have done so.
And what about shisha? Because that is a huge problem here. I mean, I've heard shisha is, 1 hour of shisha is about 80 cigarettes.
Well, I don't think it's equivalent to 80, but more like, say, 20. But
So
yes,
it's bad enough.
shisha is terrible.
Yeah.
It's considered to be recreational smoking. People sit around and have a shisha, but if you're doing it on a regular basis, it's very bad not only for the eggs, but it's bad for sperm as well.
So the people of UAE need a big wake-up call then.
Well, I think people need to be made aware that smoking of any sort
Yeah.
is bad for your fertility.
And then there's drinking. I mean, is there a recommended sort of...
Well, social drinking, a couple
Amount.
of glasses of wine a week are all right. But the worst kind of drinking is binge drinking.
Okay, so a night out.
Yeah.
So a Thursday,
Yeah.
Friday night out.
This is probably the worst kind, not only just for general health, but also for fertility. So I think anything in moderation is acceptable,
Yeah.
including coffee and smoking, or, well, smoking I don't think is acceptable at all. But coffee and moderate levels of alcohol intake are probably not so injurious. But anything in excess, and I think people just have to be a little sensible about their lifestyle. They need to have enough exercise. They need to make sure that there's not too many toxins that they're taking in, and just by and large eat healthy and live a healthy lifestyle.
So all those takeouts and all those deliveries and
Can't do any good to you.
cannot do. All right. So we know that infertility is on the rise. Now, is it that female infertility is rising faster, or is it that male infertility is rising faster, or?
You know, that's difficult to answer, because really we don't treat it as a male factor or a female. We treat fertility as a condition affecting a couple.
So as a unit, together?
Yeah, it's as a unit. We know that most men would like to believe that it's a problem that only affects women, but it's not true.
Doesn't surprise me.
Not true, because when we analyze all the patients, all the couples who come in to see us for their fertility problems, we find that in about 35% of the times, it's a pure male factor. There's a problem with the man's semen. His sperm is weak, the number is low, they don't swim well enough, they have abnormal shapes, and that is the reason why this couple isn't able to achieve a pregnancy.
And on this, I can hear all the ladies sort of clapping and saying, yes, it's not just us.
In another 35% of the cases, we find that it is a purely female problem.
Sorry, ladies.
Either she's got a hormonal imbalance which is allowing her to produce eggs,
Right.
or she has less eggs in the body, and she's beginning to run out of eggs,
Okay.
or there's a problem with the uterus or with the tubes. So it's a female problem in 35% of the times. In another 20-25%, it's minor problems on both sides,
Okay.
combined problems, and together they cause this couple to be infertile. But there is a small group of people, 5 to 10% of couples, where in spite of intense investigation, we're still not able to find out what is the cause of this couple's infertility, and we call it unexplained infertility. So that's the average sort of breakup of
So
most
it's pretty much
infertile
an
couples.
even playing field.
It is.
So for those of you keeping score, nobody takes the blame. So we know that there are a fair amount of external factors that are detrimental to a person's fertility. But what does it do? I mean, what does smoking do to a man or a woman? Or what does weight gain do to a man or a woman that causes infertility?
Smoking in a woman, we know, is directly toxic to the eggs.
Okay.
We know that a girl who smokes is likely to run out of eggs well before her time.
Right.
As much as 4 to 5 years before she was destined to run out of eggs.
And just so we know, what is her time frame of egg making or her childbearing
years?
years?
Fertility is maximal till the age of 27 or 28. It starts declining thereafter. After 37, the decline is steeper. After 40, it's a very, very steep drop in their fertility. So this is about the time when the number of eggs left in the ovary are very low.
Right.
And we know that the last few eggs that are left in the ovary tend to be poorer in quality.
Okay.
We know that these are the eggs which are more likely to have chromosomal abnormalities. And that's why we know that women who conceive in their early 40s or mid 40s have a much higher chance of having miscarriages.
I see.
They have a higher risk of having a baby with Down syndrome.
Because the egg itself is
because the egg
abnormal
has
or poor
chromosomal
quality.
abnormalities.
Right.
So, but on an average, women would achieve menopause at about 46, 48. That's the sort of average age
But
for
if they
men.
smoke?
But if they're smoking, they would probably go into menopause earlier.
Right.
So that's as far as women are concerned. But for men, it's more difficult to exactly pinpoint what is causing the problem.
Okay.
And I'm constantly faced with men who say that, oh, my father smokes 2 packets a day and he had 7 children.
Right.
So why are you telling me that just because I smoke, my sperm is poor? And it's very difficult to answer the question. What I say to them is, no 2 people are the same.
Yeah.
Your sperm producing epithelium, or the tissue that produces your sperm cells, may be a lot more sensitive than somebody else's. So the same toxin, smoking, could have a more harmful effect on you than somebody else whose sperm producing tissue is not so sensitive. And most men who smoke aren't convinced even by this.
Yeah,
And,
because they're always looking for
then
excuses to not.
Yeah. And one of the things I say that if I give 2 people penicillin injections,
Which is an antibiotic, right?
which is an antibiotic, one might have a reaction to it and die, while the other is unaffected. So don't see what other people are doing and how they are affected by their smoking. Every person is different. And if you already have poor sperm to start with, you're not doing yourself a favor by carrying on smoking.
And it could also be, I mean, this is just from my own understanding of what you're saying, but if probably earlier generations, so like yours or your fathers and your parents, it was probably that they were generally fitter beings. I mean, they walked more. I know they, played outside more. There were less external toxins that they were exposed to.
Very true, because
So,
we are exposed to far more environmental toxins than the previous generations were. For instance, plastics elute a chemical called bisphenols.
Yeah.
Just plastic bottles used to store
when they
water.
degrade, yes, I've heard that.
We know that this is toxic to both eggs and to sperms.
Oh gosh.
Pesticides, exhaust fumes.
So it's a cumulative
all
effect.
These things,
isn't it?
lots of chemicals which are present in the environment today are toxic to eggs and sperms, and these weren't there 25, 30 or 40 years ago.
And I've heard something called low motility, and low sperm count, and these are terms that are thrown around just because it's very hip to talk about it.
Well, when we analyze a gentleman to see if there's a problem as far as he's concerned regarding fertility, we ask them to give us a sample of semen, and in this we look for 3 or 4 different things. We look to see how many sperms he's producing.
Right.
And as long as he's producing over 15 million sperms per ml, that count is considered adequate. But most men would be producing much more than that, 40, 60, 100 million sperms per ml. But as long as it's above 15, it's adequate. Below 15, we say it's a low count.
Okay.
We expect to have at least 32% of the sperms swimming actively and progressively. So they essentially move about rapidly.
Essentially how mobile they are.
If less than 32% of the sperms are moving well, this is likely to compromise the gentleman's fertility.
Okay.
And the third thing that we specifically look for is the shape of the sperms. There are some men who produce enormous numbers of abnormally shaped sperms, and these sperms obviously aren't able to function as well as normally shaped sperms are. So for instance, they may not be able to fertilize an egg.
So what is an abnormally shaped sperm? I mean, I know it looks like a tadpole, but...
So as long as it looks like a tadpole, it's all right.
Okay.
When the head is small or too large, or it's funny shaped, or there are 2 heads or 2 tails, these are called abnormal sperms.
Almost sci-fi mutations that you were talking about.
Yeah.
Within fertility medicine, I mean, what is the success? I mean, when a couple walks in, because I've done a little bit of homework, Google, i.e., and looked at a couple of websites, and some fertility units boast of an 80% or a 90% success rate. Is that true?
Unfortunately, statistics can be manipulated the way you want to.
For a marketing tool, really. Yeah.
So, obviously, you choose a very fertile population.
Okay. So say below a certain age.
Below 25 years of age.
Right.
And analyze the pregnancy results from IVF.
Yeah.
You're obviously going to have very good pregnancy rates.
Okay.
But you analyze pregnancy rates of women over the age of 40, they're obviously going to be very, very much lower.
So what you're saying is they've taken a select population.
That's right.
Then. So what are the chances then?
Let's take the average patient who walks in.
Okay.
They're usually between the age of 30 and 35.
Right.
they've not been able to conceive. In this age group of patient, if you take IVF or CONCEIVE results, roughly they're in the region, any good unit anywhere in the world will probably report results between 44, 46, 48 sort of percent.
So it's still on the lower side though, isn't it?
Well, bearing in mind that in a natural cycle, the way God made us, our fertility per cycle is roughly 20 to 22%. So here in one cycle, you're able to give a pregnancy almost double. So even though it's not 100%, and the odds are still stacked against you, but with IVF, we're doing better than what nature can achieve.
Okay, but at the same time, I mean, I've heard of a lot of couples that come, they do whatever procedure, because I know there are many kinds of infertility procedures. They get that done, they're very happy, they're ecstatic, there's a heartbeat, they're pregnant, and then a few weeks later, they're not, they miscarry. Why do they miscarry? I mean, is that normal, or is that just something IVF sees, infertility sees?
Well, IVF pregnancies are like any other pregnancy.
Okay.
We know that 15 to 20% of all pregnancies miscarry.
Even
normally conceived pregnancies. And the same thing happens with IVF pregnancies as well.
Okay.
So there is bound to be a certain amount of miscarriages even amongst babies conceived after fertility treatment. And this is to be expected. And here, age is of great importance.
Okay.
Because younger women will have less chromosomally abnormal eggs, so more normal eggs, more normal embryos, and are less likely to miscarry. Whereas girls above the age of 40 are much more likely to miscarry.
So
they have a higher
the miscarriages happen because the egg is abnormal to begin with?
One of the common causes, it's not necessarily the egg, it could be the sperm.
Okay, so...
But the embryo that was generated from the egg and the sperm was chromosomally abnormal, and that's the reason for the majority of miscarriages.
And I've heard there are some women that regularly, not regularly, but recurrently miscarry.
Yes, there is this condition which we call recurrent miscarriage.
Okay.
Traditionally, we used to be told that a woman must miscarry 3 times before you can brand her as a recurrent miscarriage woman, and before you start investigating her.
And that's quite traumatic to put them through that, isn't it?
And I think that's unkind. So routinely, if someone has had 2 miscarriages, I think it's time to investigate her, and the most gynecologists or fertility specialists are now beginning to investigate a woman if she's had 2 miscarriages. It's important to take a very careful history to ascertain exactly what happened, at what stage of pregnancy she miscarried, did she have scans, was there a heartbeat present in any of the scans, when she expelled her pregnancy, did someone check the chromosomes of the baby? So these things are helpful. And as I was saying, the majority of miscarriages occur as a result of chromosomal abnormality in the embryo. And towards this, we have something which is quite helpful, and I'll talk about that in a little bit. It's called pre-implantation genetic screening of embryos.
Now that's a fancy word. Let's not talk about it later. Tell me, what is that?
Well, pre-implantation means before a pregnancy starts. So when
you have the
embryo, before it implants, that's pre-implantation. Genetic means checking the genetic makeup of that embryo.
The code, the DNA coding of this baby.
Correct. And screening. So if we are able to screen embryos for genetic diseases or chromosomal abnormalities, before we put these embryos back, it's obviously going to give us better pregnancy rates.
And you prevent this miscarriage,
and in women who've had recurrent miscarriages, we can decrease the risk of a woman miscarrying again.
So, sorry, this was called pre-implantation genetic diagnosis?
Or screening, pre-implantation genetic screening.
Okay, so this is the PGD that I've heard of.
Yes.
So, I'm going to get to that in a minute, but I mean, what I can imagine, I mean, all these techniques are quite cool and very high tech, which probably means they're also very expensive. Not very many, I presume not everybody can afford such costly treatments. And so, you know, when you couple it with the fact that IVF on its own gives you a 46 on an average % success rate, it sounds a bit bleak, you know, for a couple that walks in. It almost sounds like the odds are against you. And how do you sort of encourage your patients to go through with it? Because I imagine it's quite emotionally traumatic and turbulent and exhausting and financially draining. And
well, the thing is,
how do you support
I think
them?
the best way to approach a couple with these sort of who are in this kind of situation is to be honest and blunt with them.
Okay.
Present the facts
So
as
the
they
tough
are.
love.
Well, it's kinder to let them know what their chances are,
Right.
what they're going to have to pay for it,
Yeah.
and what they can expect. And then the couple takes their decision.
Okay.
Because essentially, it's unfair to counsel someone who is 45,
Yes.
has very few eggs, is probably making chromosomally abnormal eggs most of the time, and tell her that you have the same pregnancy rate as someone who's 25.
It's probably unethical as well, isn't
Completely
it?
so. So we are very, very clear about this. We tell them for each individual age group, we tell them this is what your chances of conceiving are. This is how much it will cost you. They take the decision. Unfortunately, fertility treatment is not cheap.
No,
Fertility
it isn't.
treatment involves a lot of high-tech equipment.
Yeah.
It involves a lot of disposable,
expertise, isn't it?
skills, expertise, and a lot of disposable and expensive material that is used.
Right, so the costs just add
So
up, don't they?
Absolutely. And
But that being said, I do know it's cheaper here in the UAE because I looked up at a couple of websites, and I remember back when I was in the United Kingdom and I looked at those prices that the NHS had to suffer, and it's definitely
yeah,
a
I
fraction
think
of that
we're
cost.
we're able to offer IVF, and for that reason we have fair amount of medical tourism from the UK
wow.
and from the US. So we have couples coming. Well, we have two kinds of medical tourism. We have medical tourism from countries which aren't able to offer very good quality fertility services. So for instance, a lot of patients from East Africa, Nigeria, and the neighboring countries
Right.
from the Middle East. But there's also the medical tourism where people come across, they combine a holiday with a fertility treatment which is probably half the cost of what it would be in the US.
So you use that extra amount to get some sun in
Yeah.
Dubai and,
So-
and the beaches and the Any one case or story that you can tell me on where in particular the outlook was bleak and then still the couple came out winners and parents and
Well, these cases that you talked about, the recurrent miscarriages.
right.
And sometimes I wonder, is it worse to not be able to conceive, or is it worse to conceive and lose pregnancy after pregnancy?
Yeah.
So we've had couples come in who've lost 5 or 7 babies
Oh, wow.
during. So in some ways, that's probably more difficult to cope with or accept.
I think the loss of a child for a
So
parent.
we've had a number of patients who've come to us with these sort of situations, and recently somebody walked into the clinic with a set of twins, and that was nice because this is someone who had lost 7 pregnancies before.
Oh,
She came
wow.
into us, and
now has twins.
And now has twins. So
When
we
it
were
rains,
able
it
to,
pours.
Yeah, we were able to PGS, screen the embryos for genetic abnormalities, and we were able to, she asked for 2 embryos to be put back. These were 2 embryos out of 13 which were chromosomally normal. The other 11 were chromosomally abnormal.
And
So
by screening, you put the ones that...
we put the ones that were chromosomally normal, and they just took. The pregnancies went on, and she delivered twins.
Wow.
So this was a nice story. But the other nice story was about a week ago when one of the pregnancy results came in.
Right.
So once we've done, for instance, an IVF, we do an egg collection and we put the embryos back, and roughly about 12 days after the egg collection, we get the pregnancy result, whether it's positive or it's negative, and it was positive, and we were thrilled.
Okay.
And the reason why I was so thrilled was that this was a girl who I had done an IVF for her mother 23 years ago.
So now the children are
And
coming
now
back to you.
this 23-year-old or 22-year-old girl had got married 3 years ago, wasn't able to get pregnant,
Right.
found it was a problem with her husband's sperm.
Right.
So we did an IVF or an ICSI for her, which is a kind of IVF, and she's become pregnant. So
Wow.
we got this result back just a week
As
ago.
they say, mashallah, in this part of the
Yeah.
world.
So that was encouraging.
I've read about something called egg freezing. Now, is it exactly what the words imply? Freezing of eggs?
Yes, it is actually very, very typical of advances in fertility medicine. We are now able to freeze eggs.
And how would you, why is that
Sperm-
useful?
Well, sperm freezing was always available.
Okay.
It is available for a long time, and it was
For men, this is.
used typically for men who had been diagnosed to have some kind of a cancer,
Okay.
and they hadn't completed their families or they weren't married. So before they started their chemotherapy or radiation,
Right.
they would freeze their sperm,
Okay.
and once the treatment was complete and they had recovered, quite often they would be left with no sperm at all
And that's because of the cancer treatment?
because of the cancer treatment.
Right.
And for years, we'd hoped to be able to offer something like this for women too. But unfortunately, the technique for freezing eggs that was available at that time wasn't very good.
Right.
So we could freeze eggs, but we weren't able to recover the eggs as easily.
So you couldn't thaw them?
When we thawed them, we would lose a lot of eggs, and the quality of the eggs would have deteriorated quite substantially.
Right, okay.
But recently there's been this new technique that's been introduced to freeze eggs. It's called vitrification, and vitrification essentially means turning into glass.
Okay.
So you vitrify an egg, and when you thaw it out, you get beautiful eggs back, and these eggs,
No compromising of the quality?
almost none.
Wow.
So these eggs do just as well as fresh eggs. They fertilize, they make embryos, these embryos grow, and
become
they've given us
pregnancies.
lovely babies.
Wow.
So-
that's incredible.
Egg freezing was known to be, or was thought to be, an experimental treatment till about 3 or 4 years ago. Now it's something that can be offered to women. Now, why would you want to freeze eggs? Well, for two reasons. One is medical reasons.
Right.
For instance, a young lady, 28, 30, hasn't completed her family, or isn't married yet, is diagnosed to have some kind of malignancy, say cancer or a leukemia
Yeah.
or a lymphoma. And here again, once she goes on to chemotherapy and radiation, the likelihood is that once she completes her treatment and is diagnosed to be cured of the cancer,
So cancer-free.
cancer-free,
Right.
she's probably not going to be having menstrual cycles because the treatment has knocked out her eggs. So in this situation, before she actually starts her chemotherapy or radiation therapy, we can stimulate her ovaries,
Okay.
retrieve eggs,
Right.
and freeze these eggs, vitrify these eggs. And once she's been declared as cancer-free, she can then
Use those eggs.
use those eggs to try and get pregnant. Alternatively, the ovarian tissue itself can be frozen,
Okay.
and once she's recovered from the cancer, this ovarian tissue can be reimplanted into her pelvis.
So when you say ovarian tissue, you mean the lining of the
The
ovaries?
covering of the ovary, which is where the eggs usually lie.
Okay.
So that is the medical reasons for egg freezing. But more commonly, so this is why this technique was developed,
Right.
essentially to be able to offer some hope to young girls who develop cancer. But Obviously, there's been spin-offs. So now
How do you mean?
we're being approached by girls who are 35, 36, 37, haven't found Mr. Right yet.
Okay.
And they're worried that by the time they find Mr. Right, they would be in their 40s.
And the egg
and
quality isn't going to be so
well,
good.
either they'll have very few eggs or they'll have very poor quality eggs.
Yeah.
So we've had a number of people contact us to find out about egg freezing.
Wow.
And it is definitely a sensible option for people who want to preserve their fertility for future. But there's another reason why women want to freeze their eggs, and that is a little more controversial, should I say.
Yeah.
And that is girls in their mid-30s who are, their career is on the upswing.
Right.
And they don't really want to take time off to be pregnant and be involved with child rearing and want to delay having the babies till they're 40 plus, so that they could have achieved whatever they wanted to achieve in those 5 years.
Yeah, I heard about this. I think Google and some of the big multi-billion-dollar companies in the States had offered their employees this alternative.
I've read about this as well.
Yeah.
I'm not sure how many women have opted for it.
Yeah. But it's there.
It's there.
Earlier you mentioned PGD and you said how you screen for genetic abnormalities, and you very lightly touched upon how women post the age of 40 have abnormal chromosomes, and you said something about Down syndrome babies. Now, I'm curious, can you screen for other diseases?
Of course we can. There's lots of genetic diseases that we can screen for now.
Okay.
So for instance, I'll just give you an easy example. Look at the royal family, Britain, Russia. They used to have this genetic ailment called hemophilia.
Okay.
So whereby if the person had a small cut, he would bleed excessively.
Okay, so
the blood wouldn't clot.
Right.
This is a X-linked disease. So women would be carriers,
Right.
but men who've inherited the gene from their mothers would have the full-blown disease.
Okay, because men are XY, aren't they?
Yes,
It's
so they only have
chromosomally,
one
yeah.
X, and that X is unaffected.
yeah.
They would have it. So in these cases, it would be sensible for a woman who's already had an affected child,
Yeah.
if she was desirous of having another child, to choose a child who's not affected, and that would essentially mean a girl.
Because yes.
Because the girl would only be a carrier.
Yeah.
So that's a simple example, but it can be you can be screened for various things. In this part of the world, in the Middle East, especially in the UAE, thalassemia is very common.
So now that you mentioned thalassemia, correct me if I'm wrong, it's a disease where the blood is not able to carry a normal amount of oxygen
Correct.
to the body's tissue. So
Yes.
basically the child gets breathless, and a little bit of exercise or exertional activity tires them out, and in very severe cases they actually suffocate and die.
Yeah.
Am I
And
correct?
They also tend to have stunted growth and
Yes.
other ailments that can come with this. So thalassemia is common in this part of the world, and if a couple already have a child affected with thalassemia, they definitely don't want to have another child.
No.
Any subsequent child that they have has a 25% chance of being affected with the full-blown thalassemia.
Right.
And this is where PGD is useful, because we can screen the embryos for thalassemia and pick up embryos which are either unaffected or are carriers. So they won't have the
Full-blown
disease.
I see.
And by and large will have a normal life. So we can use those embryos to transfer into the uterus of this woman, and then she could have a baby
Who
which
is
was
normal.
essentially normal. But there's another thing that can be done through PGD, and that is if this couple already has a child affected by thalassemia,
Yeah.
they have another child, they make sure that this child is not going to be affected by thalassemia,
Yeah.
but they can also screen the embryo to see whether it is a tissue match for the older sibling.
And how would that be helpful?
So the child that is then born, if he has a good tissue match with the previous child, he could be a donor for bone marrow for the older child.
Wow, so like a savior sibling.
Exactly,
so to
they're
speak.
actually called savior
Oh,
siblings.
wow.
So this is another of the things that we can achieve through PGD.
That's incredible. That
Yeah.
kind of advance in medical technique is just incredible. I presume that when somebody walks in and they say to you, you know, we have some history of some genetic disease, do you do a very vigorous genetic counseling? Do you sit them
Well,
down?
we try and do as best as we can, but by and large, if we feel that we are getting out of our depth,
Yeah,
we refer them to a genetic counselor
right.
who then gives us
A thorough history.
a thorough history and advice as to what the chances of having another child affected by the same ailment are.
Okay.
And based on that, we offer them a chance to take a decision regarding what treatment they want. Do they want to do PGD to screen their embryos and only put back healthy embryos or not?
I also recently read, and I do know that you can use it for gender selection as well. So, or as the politically correct term is family balancing.
Yes, we do have
Yeah.
requests for that, and we had an interesting patient. A lady came in and said, "Look, doctor, I have no problems with fertility.
Yeah.
I only have to look at my husband and I get pregnant. But I have got 4 boys.
Oh,
And my worry is that when they get married and there are 4 daughter-in-laws, who's going to take my side?"
so she wanted a little girl.
She wanted a little girl.
Oh,
So she
God.
was asking, or she was inquiring about how she could go about having a little
Balancing
girl.
the 5 men in her life. Are you worried about the ethical and moral implications of? Because I have read some pretty absurd articles, mainly in the West, about the coined phrase "designer babies." Does that bother you? That, I mean, with these kind of advances where we can actually screen the very DNA coding, that somebody might say, well, I want a blonde baby with blue eyes or green eyes, or
I don't think that's going to happen. If you're calling babies free of disease designer babies, go ahead and call them. We are providing a service to a couple who've had an afflicted child.
yeah.
And
we
you
want
can
just a healthy
and
child.
they just want a healthy child. So if you want to run it down and call it designer babies, and that's fine. But really, the business of being able to get babies with blonde hair or
Yeah.
blue eyes or purple, I mean, that's not really going to actually happen.
Okay. So there's a lot that a couple needs to consider before they come to you. What is your advice? When should they come and see you?
Well, once they've started trying to have a baby,
Yeah.
and if the couple is young, the age of the wife is less than 35 years. If they've been trying for a year and they haven't achieved a pregnancy, they need help.
Okay.
If the woman is over 35 years of age, her time is short.
Okay.
She needs to move faster. So if they've tried for 6 months and haven't achieved a pregnancy,
Right.
they should seek fertility advice.
Okay. And obviously, I'm sure all the information on how to contact you is on the website. So
Yes.
conceivivf.com.
That's the website they need to look up. Telephone numbers, locations, everything is available there. And they're most welcome to come in and have a chat.
Well, I hope this has been educational. Do you think I asked all the right questions?
I think you did very well, Melanie.
Thank you, Dad. Thank you for chatting to me in this slightly formal yet informal way.
Pleasure.